Welcome back to Wine Wednesday. Cheers!
Cheers.
Now, I've been wondering, what are some of the most effective treatments for elbow and wrist pain?
First, you need to have your elbow and wrist pain properly evaluated by a physical therapist, preferably, and or your physician, to make sure that they are getting to the root cause of the problem and that then they are treating it effectively so that they know whether or not that elbow or wrist pain, is it coming directly from your wrist, is it coming from your elbow, is it coming from your shoulder girdle, is it coming from your neck, so that then they are able to devise the appropriate treatment options. And here at Kriz PT, we tend to do a lot of work with our hands as our modality, doing different manual therapy techniques and what we call neuromuscular reeducation or motor control. Can you talk a little bit more about how we work on that neuromuscular reeducation and motor control, what I'm talking about, to make it more
Sure.
understandable?
Of the wrist and the hand. Whenever we gain motion, we're working with somebody who's unable to, say, fully extend their wrist or flex their wrist. We can passively and use joint mobilization and active stretching to get it there, but then we have to re-educate the muscles that haven't worked in that range. So you could fully passively flex, but maybe you can't actively flex because your brain, first of all, doesn't remember that your wrist can actually bend to that angle. So we have to do exercises of various types at that end range to re-educate the brain, to make sure that your brain understands, oh, I can do that.
Nice. What about different manual therapy techniques? Because that's a term that's often just kind of thrown around, that people say, oh, I do manual therapy, oh, I do manual therapy,
Okay.
and that what they barely do is like this.
Sure.
They pull up, Bertha's really good at some of her techniques, but
Really good, yeah. So she's got no
there are
hands.
some days, if she's not quite feeling up to it, then
Yeah.
maybe she just sits on somebody's shoulder.
Do you want me to
like
talk about the
this.
techniques? Or you're gonna
Sorry.
babble? Okay. So if I'm working, or Tiffany is working on wrist extension, we've cleared the elbow, we've cleared the shoulder, even the fingers, and let's say we're mobilizing the wrist. There are several carpal bones at the wrist that make up your wrist, and they all have to move on each other. If they don't, then the wrist isn't going to move appropriately. Also, the radius and the ulna, the long bones of your arm, articulate or join with those bones, and they need to have flexibility too. So we will often take our hands to help move those bones on each other, whether with direct pressure and movement or working the soft tissues that might restrict that as well.
All right. Cheers!
Cheers.